Hello everyone, I'm Apurwa. Welcome to this session of Improving Patient Care through AWS Healthcare. I'm a Solutions Architect at the AWS London office, where I've been working for 2 years and total of 4 years at AWS. Let me share my background with you all. I hold a bachelor's degree in computer science engineering, and I started my job as a software engineer in India back in 2013. Throughout my journey, I got the opportunity to work with several technologies and various product and service-based companies. So what is an SA at AWS? There are several roles at AWS called Partner SA, Specialist SA, Account SA. As an Account SA, I have a diverse set of responsibilities where I act as a trusted advisor to my customers. I review their architectures and I support with any kind of enablements they may require, among other duties. I typically go through this kind of workflow, which is a structured workflow to engage with my customers, which starts with problem identification and discovery. In these phases, I generally work with customers to understand their problem and their challenges, and I provide a solution which is well architected, which demonstrates its potential and the business value to the customers, which I follow up with any kind of upskilling which is required for my customers in AWS services. This progresses through a deployment cycle from development till production, and I, as an Account SA, work with my customer throughout this journey. So today we are going to talk about healthcare industry, their challenges, and how AWS Healthcare helps to address those challenges. What is the solution architecture, benefits, outcomes, and the future impact? So the healthcare industry comprises an extensive network of organizations working interdependently, which includes providers of clinical services like hospitals, physicians and nurses, pharmaceuticals and medical technology innovators, health insurers, both public and private, and governmental agencies focused on public health initiatives and policies. For example, in the UK, NHS is a healthcare provider, payer, and the HealthTech organization. NHS Digital, NHSD, provides digital healthcare services. Let's have a look at what are the common challenges in the healthcare industry. The typical challenges in the healthcare industry suggest that the administrative tasks are time-consuming, manual, expensive, with fragmented information in multiple formats like text, audio, handwritten notes that warrants the need for an automated purpose-built solution, which reduces the wait times, focus on quality care of patients while generating the accurate medical insights in timely manner. Now, we saw the challenges and we understand why do we need a better solution for healthcare industry. Now, let's explore the what and how. AWS helps to improve patient care by providing purpose-built services for healthcare to help healthcare organizations gain access to and accelerate insights from their own data, third-party data, and multimodal data. AWS accomplishes this by delivering the technology and expertise that healthcare organizations can trust. With the most secure and reliable cloud platform, AWS and AWS partners enable the organizations to modernize with confidence and innovate with ease in order to accelerate healthcare transformation, fuel innovation, unlock insights, and enable seamless care delivery. And to achieve this AWS has created purpose-built services specifically for healthcare customers. Now let's see what are these services. Amazon Comprehend Medical. It is a natural language processing service which uses machine learning models which are pre-trained to understand and extract the health data from the medical text such as prescriptions, procedures, or diagnosis. Amazon HealthLake. It is a fully managed FHIR data store. FHIR stands for Fast Healthcare Interoperability Resources, which is a de facto standard where healthcare industry is merging payers and providers in order to exchange information in a standardized and uniform format. scalable analytics service to analyze and make sense of the data. You can use the service to identify trends, make predictions, and share data securely. AWS Health Imaging is designed for builders who develop cloud-native medical imaging applications. Health Imaging ingests data in the DICOM P10 format and provides APIs for low-latency retrievals and purpose-built storage. Amazon provides another service, which is AWS HealthScribe, which combines speech recognition and generative AI to help reduce the burden of clinical documentation by transcribing the patient-clinician conversations and generating easier-to-review, streamlined clinical notes. Now let's have a look at what are the medical workflows where these purpose-built services can integrate with other services to accelerate meaningful insights with the benefits of cloud technology. Now, we understand that the conversation between healthcare providers and patients, it provides the very basic foundation of the patient's diagnosis and treatment plan and the clinical documentation workflow. It's critically important that this information is accurate. Amazon Transcribe Medical can serve a diverse range of use cases, such as transcribing physician-patient conversations for clinical documentation, capturing phone calls in pharmacovigilance, or subtitling telehealth consultations. It's important also to extract medical information from the unstructured data for use cases like identifying gaps in care and improving hospital efficiency, rapidly identifying adverse effects of pharmaceutical products to improve drug safety and meet regulatory requirements, where Amazon Comprehend helps. Patients today walk around with thousands of data points collected throughout their health journey, which is difficult to make data actionable because data is siloed, unstructured. Now, healthcare systems are under pressure to capture more data, maintain level of services, and respond quickly to patients' need. Now, HealthLake stores clinical or claims data using interoperability standards, and you can unlock the potential of your health and science data at scale. Over more than 3.5 billion imaging procedures done each year, with average procedure size of 150 MB. And AWS Health Imaging helps manage ever-growing image data for storing, analyzing, and sharing medical images at petabyte scale. Here you can see all of these services integrate with many other AWS services conveniently to achieve the desired outcome in healthcare industry, hence improving the medical workflows and contributing towards a better patient care experience. Now let's have a look at each of these workflows individually. Clinical documentation workflow. Now, whether users want to dictate medical notes or transcribe drug safety monitoring phone calls for downstream analysis, it's critically important that this information is accurate. However, accurate information or the medical transcriptions such as dictation recorders or scribes, they are expensive, time-consuming, and disruptive to the patient experience. Now, some organizations use existing medical transcription software, but find them inefficient and low in quality. Transcribe Medical offers accurate speech recognition that is both scalable and cost-effective. Amazon HealthScribe automatically creates clinical notes from patient-clinician conversation through generative AI. Now, it's important to extract the health data from the medical texts, such as prescriptions, procedures, or diagnosis. Amazon Comprehend Medical, it's a natural language processing service that uses machine learning that has been pre-trained to understand and extract the health data from medical text. Input the data from clinical notes into Comprehend Medical in order to extract medical information from unstructured medical texts like doctor's notes, clinical trial reports, or radiology reports. You can also use Amazon Comprehend Medical to identify relationship among extracted health information and link to medical ontologies like ICD-10-CM, RxNorm, and SNOMED-CT. Now, Amazon HealthLake or AWS HealthLake comes with an Athena lake formation integration without the need for complex ETL. It allows you to quickly explore trends using SQL queries about your patients or population and personalize the care at individual level using Amazon QuickSight. You can build, train, and deploy machine learning models with SageMaker to make predictions earlier than would have been previously. So that way, you can intervene more quickly to improve care and reduce the cost, such as predicting patients' risk of heart failure of sepsis or optimize and improve the patient flow. With AWS Health Imaging, you can store and stream your medical imaging data directly from AWS Cloud while preserving low latency performance and high availability. You can save cost on long-term image archival while maintaining sub-second image retrieval access. You can run AI ML inference over your imaging archive with support from other tools and services like Amazon SageMaker or Amazon Bedrock. With health imaging, you can reduce infrastructure costs by running your medical imaging applications at scale from a single authoritative copy of each medical image in AWS Cloud. Now let's have a look at the demo to see these services in action. Okay, so let's look at the AWS HealthScribe. So currently, there are no jobs created. We click on the new conversation and create a job. We put all the necessary settings like audio identification type, the number of speakers in the audio file. You can either upload your recording or you can do a live recording through the console. For this demo, I'm uploading a demo audio file and I'm going to show you the content soon. Once this file gets uploaded, let's have a look at what are the contents. This is a conversation between patient and the clinician about certain disease. When I click on submit, the job creation procedure starts. When it goes to 100%, that means we have uploaded the audio file to Amazon S3 and also the job creation will start now. Here you can see the status of the job is in progress. You can click on the refresh button to refresh the status of the job creation. Once the status turns to complete, it's going to show you when the job is going to expire. Now, in order to see the details, you have to click on the job name. And this job is going to give you multiple things, including the audio file that you submitted, the transcript file from the conversation, and a summary file with the insights. The transcript file has the role detection. It has automatically detected the role for clinician and the patient. In the audio file, you can go to a particular section of the recording and go to the transcript text. This also provides the segmentation and identifies the small talk and the silences in the audio. And it shows you where those silences or the small talks are in the transcript, and you can eliminate those. In the summary file, the insights are generated with multiple sections which are important for a clinician for further analysis. You can see the past social history, the past family history, the chief complaint which patient talked about in the conversation, the history of patient's illness, the review of the symptoms, and the past medical history. These multiple sections are generated by AWS HealthScribe using the generative AI technology. There are more sections like physical examination, assessment, and the treatment plan, which gives further insights into the conversation which happened between the patient and the clinician. Now, when you look at any of the sentences in the summary file, you can trace back the sentence or the insight to the transcript file. So you can understand that AI has been responsibly used here, and you can use the principle of traceability, and you can trust the information generated by AWS HealthScribe. You can check the output in a structured manner. On the left-hand side, you can see transcript is divided into multiple sections or the segments like medical conditions or anatomy. For each detail described by the patient, all of that detail is segmented in different category in the transcribe file. On the right-hand side, you can see the evidence links and the segment ID. The segment ID is the ID which traces back the information in the insight or the summary file back to the transcript file. So you can understand where that information came from and where does it link back to. You can copy that segment ID and you can search back in the transcript file and you can find the relevant section or the segment. You can even download these files in the JSON format so you can use it in your downstream systems. Here's one sample of the summary file in the JSON format. Now let's have a look at Amazon Comprehend Medical. You go to Amazon AWS console and click on Amazon Comprehend. In the options, you can see two different options to create the jobs, real-time analysis and the analysis job. For this demo, let's create the real-time analysis first. Let's paste the information which we got from HealthScribe in the summary file and put that insight into Comprehend Medical as an input. When we click on Analyze, it creates the detailed description of the insights that it extracted from the medical data that we submitted. The entities are in different sections of the analyzed text. For example, you can see the medical condition, the medicines, the diseases which a patient was talking about, or the clinician was subscribing the medicines. So you can see all that segmented entity information in the output. Another thing is you can also use different kinds of norms and concepts to analyze your data, for example, RX norm or ICD-10-CM. So according to that norm, it's going to show the medication or the medical diseases information to you, either in the entity format, in the visualized format, or you can even check the textual format and find out more information about specific entity detected from the medical text. For example, lump, injuries, the spraining ankle. You can click on more information and you can find out more information like score and other information related to the entity. Another way is to batch analyze your medical data. Similar way, you can create a job, put the job name, you can select the analysis type, and you can input the S3 location from where your data is residing, and your Comprehend Medical is going to fetch that data. You need to put an output S3 location where the data is going to go, and you can again have a look at that data. Now have a look at AWS HealthLake, where we can create the data store. Once you click on Create the Data Store, you can put the job name. For this demo purpose, I'm going to preload the FHIRR format data. You click on Create Data Store. Once the job is created, you click on the data store and click on Run Query to start querying your data. It's as simple as that. Now, you click on Data Store ID for your data store. For the search type, you can run multiple queries. For this demo, let's start with the search. We can search the document reference, for example, and let's see what kind of different details we can find in the document reference. Here you can see multiple different segments of data, document reference, the ID for the document reference, and more information for the dummy data that I preloaded. Here in the data section, you can see this is not understandable. But when you decode that information as it was in base 64 format, you can see that information in the form of clinician notes. Instead of document reference, you can put patient to search about the patient detail. If you click on Run Query, it's going to show you the information related to patients. For example, different patients' data and IDs for different patients. And this is the metadata of the file of the patients in the data store. Here, I did not hide the information, but you can use encryption to mask the data, which is PII data. Now let's take one of the IDs and search for a specific patient. I'm going to copy this ID and let's see how we can do a parameterized search. You can click on Add New Parameter. I'm going to put Identifier and I'm going to put a patient ID over there. Let's click on Run Query and it's going to show you individual patient information. With patient birthplace, examples, details like, so whatever you can find in the data store. Social security number, and again, it is possible to encrypt that data because this is a PII data. You can encrypt it, you can mask it, whatever you like. But this is for the demo purpose, so I'm just showing you all that data. Now let's get back to the lake formation and Athena integration, as I said. So lake formation is linked to the data store that you created in the AWS HealthLake. When you go to Amazon Athena, you can find your data store database already created here. You click on the data source, select your catalog, select your database, and you can start running the queries, the SQL queries. For example, the general query I'm running is the patient data. And it's going to give you all of the information in a very formatted way. Now, there could be multiple instances. For example, the data might be in array formats, right? So how do you query that kind of data? Let's see how is the patient table created. If I want to fetch first name and the last name for the patient, but there's no strict field for the first name and the last name. Let's see, there's a field called name, which is a type of array. And there are fields like given name and the family name, which I need to extract from the array. So I need to create a SQL query which extract the data from that array. So on the right-hand side, if you see, I'm creating a select query and I'm referencing the name column as name1.given and name1.family to fetch the information for the first name and the last name from the patient table. If I click on Run Query, it's going to show me a structured information about the first name and the last name of the patient. Let's run another query, which is a bit more complex. If I want to show the patient and their related conditions. So I've got a patient's table and I've got another table called condition table. I'm going to join those two tables and concatenate the information, whatever I need from both of those tables. When I run that query, it's going to give me the information related to patient and the conditions diagnosed for that specific patient. You can search by the patient ID or the condition ID in the same tables. It's going to give you more information like diagnosis code, diagnosis description, and the time. An example of another query would be, get the patient and their related procedures. What are the procedures that have been done for the patient so far? You can combine the patient and the procedures table, and you can get the relevant information. Let's have a look at the procedure table. How does it look like? Again, the information is in array format and some normal columns. So you have to build your query according to the content of the table. Let's run this query. And in the output, you're going to see the patient and the procedure information, including patient ID, procedure ID, the name, the status of the procedure, if it's completed or not, the procedure description, and other information related to the patient and the procedure. Let's have a look at another query. If I want to filter for a specific disease type, let's take an example of diabetes. If I want to search for diabetes for the patients, right? So I can put in the filter condition. I can have a join between patient condition and observation tables and put a filter condition for diabetes. Run query, and you are going to get the result for a specific disease. Here you can see the patient ID, the condition ID, the name of the patient, age, and more details. Now, related to the disease, we are going to get more details like the observation code, the observation description, for example, blood pressure, and then the value. What was the value observed for that observation? So all kinds of detail in any kind of format. You can get it here. So let's have a look at the benefits of the solution. So the benefits, definitely, we are improving the efficiency by automating the data entry and the processing, and we are reducing the manual efforts. We are ensuring that the processes are more accurate with the more accurate extraction and the integration of medical information. We are providing timely insights by accelerating the insights using machine learning technologies and the comprehensive care for the patients. Now look at the key outcomes and the future impacts of the solution. So by this automated and timely process of the patient care throughout the clinical documentation workflow till medical insights, we are improving the patient outcomes by improving their patient journey. We are getting informed clinical decisions by creating the insights which are intelligent and faster using Amazon Comprehend Medical. The insights generated are helping the research and innovation for the medical industry. Maybe it's the drug or the DNA and the RNA testing. And the solution is scalable for any future increment of the user base. I hope this session was useful for you. Thank you for watching. And if you want more information, scan the QR codes displayed on the screen. If you have a similar use case, contact your AWS account team.